So currently there are 63 active cases of coronavirus in Victoria. 11 new cases were announced in this morning's report. 9 of these are locally acquired. 6 we announced yesterday as having coming through shortly from the night before it's cut off. And there are therefore 3 that I can newly announce today in addition to those 6 previously reported yesterday. 2 of these 3 are primary close contacts who were quarantining during their infectious period, which is good news. 1 is still under investigation. They are not a known contact and are not directly linked to any exposure site, but there is very close proximity to that exposure site, and we're confident that the investigation that's ongoing will uncover further crossover points. Our public health team are actually seeing more and more of this in this particular South Australian hotel outbreak playing out a bit differently to earlier outbreaks. There is evidence of casual acquisition instead of those in direct close contact like friends at a pub, family members, and I'll get the COVID response commander to report in more detail about some of our specific priority concerns in this area. I can also update Victorians that the aged care case yesterday, the first one, the Arcare worker, the genomic sequencing has confirmed that that case is directly linked to the South Australian hotel outbreak quarantine. And that is at least confirming in our mind that this is all the one related cluster from the South Australian hotel breach. I'm also able to advise that all staff and residents at Blue Cross Sunshine Aged Care Facility have tested negative, other than that one case we reported on yesterday. That was the crossover worker between Arcare Maidstone and Blue Cross Sunshine. There have been no further positive tests at Arcare in Maidstone as well. Of course, these sites remain under strict infection and prevention control measures, and I want to particularly thank the Western Public Health Unit for leading that work, and I want to thank again the wonderful clinical staff and particularly the nurses from both Melbourne Health and Western Health who have stood into these important infection prevention and control measures and to support both those facilities as a result of their own staff having to be furloughed and quarantined. I can also advise that another Blue Cross facility which shared a worker advised that we talked about yesterday, that site has been stood down as an infection risk as the particular worker was not infectious at the period that they worked at the other Blue Cross site. That news aside, there continues to be significant concerns around ongoing transmission in particularly our northern suburbs and many large exposure sites that have been added to the exposure site list over the last 36 hours. Our public health team are currently weighing up whether there is still coronavirus circulating in these communities, and we still consider our response to the current outbreak on a day-by-day basis. With 20,484 vaccines delivered yesterday, it's been another strong day for our state-run systems, and I want to thank our hard-working vaccination staff for their efforts right across our 30-plus state vaccination centres, and just remind people that equally in fact, more vaccines are provided to our primary care and GP network, and Victorians seeking vaccinations have 2 options really as to how to meet the increased demand that we're seeing out there for vaccinations: the GP network and our state clinics. We are pleased that the overwhelming majority of frontline healthcare workers in Victoria have already received their vaccines. Effectively, it's at practical completion rates. There is already the firm expectation that healthcare workers in our system, dealing with particularly our highest risk patients, such as those with COVID-19, are vaccinated. And I note that the Prime Minister and the Commonwealth Health Minister have sought medical expert panel to review how we can all increase this density of take-up of healthcare workers and other frontline workers' density even more, and that's a move that Victoria welcomes. And we will keep doing all we can to ensure we're making it as easy and as fast as possible for healthcare and aged care workers in the public or private sector to get vaccinated as quickly as they can. To that end, Minister Donnellan will be shortly announcing further priority access for workers and residents in some of our most vulnerable settings to get the vaccine, particularly in those areas that are responsibility of the Commonwealth. Finally, there's been another strong round of COVID testing yesterday with over 40,000 tests done. And I repeat the call out that we made yesterday that the Melbourne Showgrounds Testing Centre, which has the largest capacity in the state, still has relatively short waiting times than a number of other nearby and other locations. So I would ask that all Victorians do the right thing with even the slightest of symptoms, come forward, get tested and keep turning out in those numbers. Hop on the website to get the information that you need as to what the waiting times in the closest test centre to you are, because this is how we monitor and track the movement of the virus across our community, respond quickly and move as quickly as we can to shut down lines and chains of transmissions.